The world marks World Diabetes Day this coming Friday on the 14th of November, and Africa is facing a growing health challenges that can no longer be ignored. The rates of diabetes and obesity are rising sharply across the continent, and these are fueled by our changing diets, our urban lifestyles, and our very easy access to sugary foods and sugary drinks. Governments are under a lot of pressure to respond to one controversial idea that has taken center stage over the years, and this is the idea of sugar tax. Supporters argue that it's a necessary tool to curb sugar consumption, protect public health, and save lives here on the African continent, while opponents also warn that it could devastate small businesses, something that's very necessary here on the African continent. It could also increase prices and hurt those that are already struggling to make ends meet. So today we are unpacking the topic in today's debate. This is the African view. Should Africa impose sugar taxes even if it hurts small businesses? We're unpacking this. On either side of the debate today is Nzama Mbalati, who is the Chief Executive Officer of Healthy Living Alliance, also known as HEALA South Africa. We also have Barr, Jide Ologun, who is a public analyst, joining us from Nigeria. Thank you so much to both of you for joining us in today's conversation. But I'm going to start with you, Nzama, and ask you to present your opening lines or your opening conversation for today's question. Should Africa impose sugar taxes even if it hurts small businesses?
Yeah, so certainly, thank you for having us. I think we're dealing with a bigger crisis of diabetes. Each and every one of us who are here knows someone who's living with diabetes. And I think the scourge is yet to grow. In South Africa, we know over 4.2 million people are living with diabetes. And this is an underestimated number because most of the people who present with diabetes are people who are already ill and sick to the hospital. So the screening has not been scaled up in the uptake. So we're talking of a much more bigger problem. So it will be dangerous if government doesn't regulate unhealthy products. So tomorrow it can be tobacco, it can be alcohol. So I think it's important when we're having this conversation that it's not us against them. It's an issue of how do we protect public health of people who live in Africa, in South Africa, and the countries. And I think this has been long overdue in terms of the conversation of how can we then mitigate those business that could be affected. We're speaking about diversification, right? So BRICS countries, Brazil and India, it's a good example of ethanol, and fuel for aeroplanes.
Mm-hmm.
We can't sustain supporting the sugar industry through the consumption of sugar at the expense of the population's health.
All right, thank you so much for that opening statement. I'll come to you, Olajide. Let's hear your opening statements on today's debate question.
Thank you very much. See, when you consider today's economy, it's already tough on families. When you have discriminatory and harmful taxes.
Okay, Olajide, I'm gonna stop you there. Unfortunately, we seem to have a little bit of an issue with your line. You're not very clear. So while we try and get you back on a better line, perhaps we can take a short break before bringing the conversation back to Nzama. Hopefully, we can get Olajide back on the line so you can all hear each other for the purposes of this debate. Where do you stand on today's debate topic, and what do you think on this one? Should Africa impose sugar taxes even if it hurts or goes against small businesses that need these sugars as part of their business? Let us know what you think on @Channel Africa 1, that's on X, and on our WhatsApp number +27 63 406 9126.
Siyabangena manje. Vito iJabulani Nkolele iMagoda. Jabulani is a young man from Giyani in Limpopo in South Africa. A very easy guy, taking things easy. To know me is to know that I love what I do, which I'm crazy about it. So when you hear me on radio, expect the best. Expect great music. Expect great content. Expect 180 minutes of nothing but fun. You'll find me on the morning reset, 3 to 6 a.m., Monday to Friday. siyabangena ayayayaya ngibulekeni.
This is
Channel Africa. All right, we continue with the debate for today's African View. Should Africa impose sugar taxes even if it hurts small businesses? Jide is said to have a much better line now. Jide, are you there?
Yes, I'm here. Thank
Okay,
you.
perfect. You sound so much better now. So let's once again hear your opening statements on today's debate topic.
Thank you very much. I mentioned that this economy is of family without any argument. To the contrary, having discriminatory and harmful taxes that do nothing to improve public health won't be the best. And if we want to isolate diabetes, for instance, as a health concern, there has been researches across the world stating that the cause of diabetes is autoimmune reaction, where the body attacks its own insulin-producing cells, and diet is not a serious factor in this. And when you look at the report of independent research carried out by the Oxford Economic Commission by the Beverage Association of South Africa, the sugar tax in South Africa could cost about
Hey, Jide, we're still struggling there with that line. You are interrupted there. I don't know why, but let's see if we can get you back on a better line. Let me come back to you, Nzama. You were speaking a little bit about the different, illnesses that are related to sugar. However, as much as that's the case, sugary products and drinks are easily accessible to the ordinary person, and mainly because they are a very lucrative business. So what do you say about small businesses on the African continent to thrive on these sugary products?
Yeah. So I think we have to incentivize. So that's a very good question. I think we have to incentivize, small business to actually sell healthier alternatives. So one of the things that we have been calling for as Healthy Living Alliance is to make sure that you don't just penalize the unhealthy products. You have to take the revenue that you have collected and soft ring fence it into incentivizing small business, include them into public procurement, including the National School Nutrition Program. Ensure that you make healthier food and healthier option more affordable and accessible for people, for the population. So those are some of the things we have been saying. Make sure that you don't just penalize, but you actually regulate the sugar industry at the expense of actually making sure that you take you reap those rewards into incentivizing healthier eating, into incentivizing small business, use government public procurement, for example. We have hospitals, we have schools that are giving school meals, over 9 million children in South Africa, for example. Ensure that you actually use small scale farmers, local businesses than actually even these big retailers that model we have been using, or tendering one like this central tender system, which actually is actually won or are given to one person. So I think it's important that it's not one or the other. Like I've said, it's not us against them. It's just that diabetes has reached a crisis level, and I think it's important that we can use all the tools we have in our toolbox, including taxation, including things like front of pack warning labels, including marketing restriction to children, including that, even meals that we give at school are actually of better options, So it's important that, we look at this in a holistic manner. And if you look at big sugar drink producers, they see that this business model of people consuming sugar and in diet it's not sustainable. They've bought now the bottling of water, right?
Sure.
So already, even if we can argue and get stuck in the reality of having this industry not regulated, you can see the big manufacturers have already moved, of sugar drinks have already moved into the market where they know is the future. The bottling of water, Coca-Cola has bought that, as we know now.
Okay. Nzama, I would like to unpack that a little bit more because incentivizing would mean that all small businesses on the African continent are formal. But we know that we have many informal traders that benefit from the sale of sugary products. We'll come back and ask a little bit on that, and hopefully we'll have Jide Ologun back to join us in our debate. It's 20 minutes past 10 o'clock Central African time. Let's take a break. We'll continue this debate after this.
Africa. It's time to plug into the heartbeat of the continent. Tune in to Channel Africa, your go-to radio station that broadcasts in 5 different languages.
L'Afrique du Sud célèbre la journée nationale du
Kabla hujaitwa kwa jina la double K or more of our forests have been destroyed.
Tamo kutuli bwanji ndi
Partido Africano da Independência da Guiné.
See, Channel Africa represents every corner of this amazing land. From Lagos to Cape Town, Nairobi to Dakar, we've got you covered with the freshest news, music, and cultures. So, turn up the volume, feel the rhythm. And join the conversation. Channel Africa, the African perspective. Keep Africa in your hands. Connect to our website for all your news, sports, and cultural updates. channelafrica.co.za.
All right, we're having a debate today on something that I have a guilt on. Just earlier on, I was having flapjacks with a lot of sugar in them. I shouldn't have done that early in the morning, but I did it. So there is a guilt a little bit during this conversation. We're asking today, should Africa impose sugar taxes, even if it hurts small businesses? Joining us for this conversation is Nzama Mbalati, who's the CEO at the Healthy Living Alliance, and Jide Ologun is joining us, a public analyst. Jide, can you hear me this time? Are you there?
I can hear you.
You are perfect. Now I can hear you very clearly. Yeah, I'm sure you were giving us a point that you are against sugar taxation. Tell us a little bit why.
Thank you very much. I was making reference to a research carried out far away in Mexico, and most poorest families in Mexico pay as a result of a tax that may be introduced on sugar products. And I said that when you isolate diabetes, for instance, the cause of it has been established to be due to an autoimmune reaction where the body attacks its own insulin-producing cells, and diet is not a principal factor. So if this sugar tax, which is called health promotion levy, has a vibrant intention, then focus more on education the people on their habits, because already the economy is already tough on families. Otherwise, you will be hurting many small businesses. Already, the argument is that the sugar tax in South Africa could cost about 60,000 to 70,000 workers their jobs, and about 60% of the jobs lost will be direct upstream. So you need to consider it very well, because what is the essence of trying to establish a health order that is more attached to habits through taxation? And many have argued, even when you choose to tax, how are you going to engage the tax to return value to the society? Because when you talk about an effective tax system, they are generally guided by some core principles, talking about equity and fairness, talking about certainty, talking about efficiency, neutrality, and convenience. So have you considered all this? And not just, I cited the Mexican experience. You also have other parts of the world where this has been tested. So I will be advising that the country should focus more on building businesses and trying to enculture the people to tame their diet. You just told us that you are still keyed to sugar consumption. So It's more of a habit.
Yeah, don't make
That
me
would be my
don't
position.
make me feel
I
bad
doubt
because
if tax can achieve. I doubt if tax can achieve it. We need to
okay.
look at, inclusion,
Yeah.
equity.
Absolutely. And maybe I want to take that back to you, Nzama, on some of the claims that Jide is speaking of there. Number one, the fact that it's not necessarily sugar that causes diabetes, but it's a different issue when it comes to your health condition. What's your take on that, number one? And number two, also, the issue that he highlighted around the fact that you lose a lot of African jobs if you tax sugar.
Yeah. So one, I think let's state the facts. I think my colleague is also coming from, it was referencing to research. So we have type 1 and type 2 diabetes, right? Actually, in South Africa, we have found that even type 1, in most, is not the inherited diabetes. It's one that is actually lifestyle or caused by diet, right? And lack of body activity and so on. But I think the biggest problem with this narrative of the industry, we must learn also from other epidemics. Look, when HIV came, people were like, no, we just need to preach about behavioral change. I agree that we need a holistic approach to tackle diabetes urgently, with policy and other intervention. I don't think educating people replaces regulating industries, because we know as a fact that behavioral change is so difficult. You have spoken about yourself, right, in this morning, and I think the biggest problem that we are not underlying here is there's a lot of heavy sugar diet, from your breakfast cereal, not only just sugary drinks. You will have coffee or tea during the day. So already a person exceeds way amount of sugar that you will be able to, like a cold drink can contain 6 to 8 spoons of sugar. Already you are way over the WHO recommended 6 spoons a day kind of sugar. So I think this is a big problem, because also, even if we want to talk about moving away from regulation and taxation of these sugar sweetened beverages, these big manufacturers already have reformulated, right? If you look at the South African market portfolio of sugary drinks, if we go particularly in the shop and check, you'll find less to zero sugar. So already the betrayal, and actually even the cheap sugar imports that is coming, because in Africa the sugar industry is not competitive. So people will still buy, those cheap imports in terms of sugar, because our sugar industry hasn't diversified. It's struggling with technology and innovation. We have been speaking about the huge booming market, right? Even in Europe and in the West, where biofuel and ethanol is a very critical means of converting sugar and sugarcane into this biofuel that I was talking about. So I think we have to tackle diabetes with all measures that we have, and taxation and the health promotion levy is just one of those.
All right, as we wrap up this conversation, we have run out of time. So really quickly, in 30 seconds or a minute, Jide, please give us your closing statements on today's debate.
Thank you very much. You see, in Denmark, a tax on saturated fats failed, and the government scrapped the tax only a year later. And the European Commission determined in 2014 that taxes on targeted nutrients such as sugar and sodium had no discernible effect on public health. So what else are we waiting for? So I will advise that we focus more on trying to guide the habits of the citizens rather than imposing taxes that we, increase the economic burdens on them. And that is what I call economic inclusion. So there are several approaches to taming and improving the health of the citizens. And I will rest my argument on that to say that tax imposition may be one of the approaches, but it is absolutely not the best approach.
I see.
Let's look elsewhere.
All right. Thank you so much to both of you. We have run out of time. Nzama, Mbalati and Jide Ologun for joining us in today's debate. Really good views from both of you. And of course, really important ones because they do affect our systems, our businesses, our healthcare, and our health as the people of the continent. We'll keep things moving to our latest sports news now. CEO of the Healthy Living Alliance is Nzama Mbalati, who joined us, as well as public analyst Jide Ologun. Where do you stand in this debate? Do you think sugar taxes should be imposed in Africa, even though it hurts small businesses?